Okay, sorry about that. Had to hit a wrong button, I guess, and it blew up my screen. So the first thing we're going to be talking about when we're talking about medications in the central nervous system are medications for migraine headaches. Now, as I said, this is not covered in the textbook. So when it comes to test time and study time, you want to use this PowerPoint, your PowerPoint notes, and your ATI chapters that I've given you to look at medications for migraines. Migraine headaches are headaches that not only cause pain in the head, but they cause issues with hearing and vision sometimes. They can lead to nausea and vomiting. They are not just, oh, I sat around and my shoulders are tense, I feel a little headache in the side of my head. These are comparing a migraine to a tension headache is like comparing a saber-toothed tiger to a house cat. Migraines are horrendous, and the lucky people with migraines get them occasionally in response to certain kind of triggers. Unlucky people have a regular migraine syndrome, and with some of the drugs, they'll have requirements that you can't start these drugs until you have 15 migraine days out of the month. So imagine half the month having a pounding, throbbing headache, having nausea, having light sensitivity, not being able to tolerate smells, not being able to tolerate sounds, wanting to just kind of lie in a dark room and not move your head because you're in so much pain. That's what it's like for migraine sufferers. And so there are a number of medications that we're going to learn about, and thankfully they're continually coming out with new medicines that hopefully will help. What happens with migraines, and the reason you feel this throbbing, pounding pain, some people with migraines have described being able to count their heartbeat in their head, which, I don't think I would like that. What happens is that the arteries surrounding the cranium get very inflamed. They dilate, and that increases the blood flow into the head, and that can cause a pounding, throbbing pain. At the same time, pain centers that are located in the brainstem are stimulated by an abnormal flow of electrical impulses. Remember that the brain operates on electrical activity. And when we have normal electrical action all through the brain, we can function and we can do the things that we need to do. Abnormal electrical impulses throughout the brain can cause migraine headaches, they can cause seizures, they can cause all sorts of problems. So in this particular case with the migraine headaches, you've got an abnormal flow of electrical impulses, which is stimulated by certain triggers, and they vary from person to person. So the electrical impulses send abnormal signals to pain centers that are located in the brainstem, and you end up with pain that you perceive in your head. With migraines, it can be just one side of your head, or it can be the whole area of the brain. It just kind of depends. But it's natural that when there's pain or some sort of abnormal signal sent, the blood vessels want to respond with inflammation. They want to send white blood cells and other chemicals to clean up and to take care of whatever that problem is. So the body responds by inflammation of the cranial arteries that sends a lot of blood flow to the area, which gives you that painful throbbing feeling. In turn, that further stimulates those electrical impulses to send abnormal signals to continue the pain, which causes further inflammation of the cranial blood vessels. And so you have kind of a vicious cycle of misery that can last anywhere from a few hours to days. Some people have painless migraines that manifests itself more in like temporary loss of vision, temporary loss of hearing, maybe what they think might be stroke symptoms, and they're called kind of silent migraines because they don't have that pain. But it all goes hand in hand with abnormal electrical impulses stimulating the pain centers and inflammation of those cranial blood vessels. So that's sort of the physiology behind it. Migraines have different triggers depending on the person. Sometimes they just tend to run in families, and people have tendencies for their neurotransmitters to send abnormal signals. Some people have migraines triggered by particular food or drinks that they engage in. Some people drink beer and that triggers migraines. Some people drink wines, particularly like the real full-bodied red wines. Some people, processed meats and cheeses will trigger those migraine headaches. I was fine till I ate that ham and cheese sandwich, and then, I started a migraine. Many females have migraines that are tied to their menstrual cycles, and hormone changes will trigger those migraines, and it will be worse at different parts of the month. But once again, you see that they are caused by dilated cerebral arteries and release of sensory neuropeptides, chemicals that activate primarily the trigeminal arteries, and they cause sensations of pain. For a migraine, it's in the head. For something called trigeminal neuralgia, it's intense pain in the face. And that can be so severe that it's called the suicide syndrome, because it causes pain that is so agonizing that people have committed suicide trying to stop it. So when it comes to medication for migraine headaches, we have two actions that we have to perform to relieve those headaches. We have to block the nerve impulses at the receptors of that sympathetic nervous system. So we have to block epinephrine and norepinephrine from stimulating those sympathetic or adrenergic receptors in the brain. And we have to narrow those dilated cerebral arteries. We have two classes of migraine drugs which can do that. These are the ergot alkaloids and a category of drug called the triptans. I call them the triptan sisters because all of the drugs end in triptan. Other products for preventing migraines are beta adrenergic blockers, so beta blockers that work to prevent the dilation of those blood vessels. Calcium channel blockers. Calcium channel blockers and beta blockers will both dilate peripheral vessels. Now, the last thing we want is dilation in the head, but what they do is they will cause dilation in the arms and legs. And when blood vessels dilate in the arms and legs, then the blood can drain out of those very dilated, throbbing blood vessels in the head, and it can drain into the peripheral nervous system. We also have what we call tricyclic antidepressants, and they're not as used quite as much for depression as they used to be, but they do relieve chronic pain in some conditions, and migraine pain can be one of them.